hooked up to a dialysis machine, awaiting a specialist appointment 1,000 kilometres from home. This is a situation all too familiar for many Torres Strait Islanders.
You know, all our people have been falling through the safety net.
An investigation into the Torres and Cape Hospital and Health Service has confirmed what leaders in Queensland's northernmost region already knew. Far more people here are dying of preventable health conditions than the state average.
People have been under the current system getting on planes and to do a specialist checkup and return in boxes.
Leaders in the Torres Strait are demanding the return of a healthcare model that was developed 30 years ago. It showed some success in turning around the region's soaring rates of illness.
We just want the government to give back to us what's rightfully belonged to us.
Under the Torres model of care, teams of medical staff went into Torres Strait communities under the guidance of Indigenous health workers. Patients would be recalled for vital health checks, with a software database making sure nobody was missed.
The model worked for the people, it's workable and it's doable, because you have your own people in the front line.
Well and truly will serve the people of Queensland in the office of Premier.
Locals and experts say after the Newman government swept to power in 2012, Indigenous health worker positions were cut and a focus on prevention was lost. The Torres model of care, where some senior positions in the local health service are held by First Nations people, has been slowly chipped away.
There was a change in mentality and a change in shift, and a lot of people were unable to comprehend that type of model.
Professor Sean Taylor says when he returned to his home community of Mayor in 2012, he saw gaps in patient care.
It turned into a more of an acute setting where patients were just presented at the health service and were treated with whatever problem they had, rather than looking at what the Torres model of care was looking at, was following care through their journey and then referring when appropriately.
The Torres and Cape Hospital and Health Service acknowledges it lost its way, but says it's already back on track and turning things around.
And that's reflective of what the health service investigations showed, is that we are delivering excellent care to the people of a community.
First Nations people make up about a quarter of the Torres and Cape Hospital and Health Services workforce, but this is a region where 65% of the population is Aboriginal or Torres Strait Islander, and everyone agrees increasing the number of Indigenous health workers needs to be a priority. One of the biggest barriers is the region's chronic lack of housing, which prevents many Indigenous health workers from finding somewhere to live outside their birth community or coming home altogether if they've moved away.
We've seen government build a lot of infrastructure here that is for a lot of government employees that work here as a community control health service. I don't have access to that.
There are calls for Queensland Health to hand some of its primary health services over to Indigenous community-controlled organisations. The region's elected leaders want a commission of inquiry first. Some think the government argues would take far too long.
Yes, we support a community-controlled health model like anywhere in this country, but we need to know, we need to have answers, we need to hold somebody accountable.
It's not asking for more money. We wanted to spend it more cleverly, more responsibly, and we've got to give that empowerment and the ownership to the community.
While the Health Minister, Shannon Fentiman, says the Torres Strait and Cape York are better served with a single hospital and health service, the opposition leader David Crisafulli isn't ruling out splitting them if he wins the election.
We can really hope that both sides learn from 2012 and not take away as much as has been taken away historically, because it takes so long to replace it and get it back on the agenda, and so then you're working through what that means.
Before this election, I'm looking at a class action. I'm a real patient, I'm a consumer. And you know, what about all the others that left us already?
Christopher Tester, ABC News, Thursday Island.